American Council on Exercise, Personal Trainer Manual, 5th edition, Chapter 1. This chapter was written by Todd Galati. Todd Galati is the Director of Credentialing for the American Council on Exercise. He holds a bachelor's degree in athletic training, a master's degree in kinesiology, and 4 ACE certifications. Prior to joining ACE, Galati was a program director with the University of California, San Diego School of Medicine, where he researched the effectiveness of youth fitness programs in reducing the risk for cardiovascular disease, obesity, and type 2 diabetes. Galati's experience includes teaching biomechanics, applied kinesiology, and anatomy classes at Cal State San Marcos and San Diego State University, working as a research physiologist with the U.S. Navy, personal training in medical fitness facilities, and coaching endurance athletes. Chapter 1, Role and Scope of Practice for the Personal Trainer. The benefits resulting from regular physical activity are well documented, as shown in Table 1-1. After a comprehensive review of the research linking physical activity to health, the U.S. Department of Health and Human Services released the 2008 Physical Activity Guidelines for Americans, the first comprehensive guidelines on physical activity to be issued by the U.S. government. These guidelines list the following major research findings regarding physical activity and its associated health benefits. Regular physical activity reduces the risk of many adverse health outcomes. Some physical activity is better than none. For most health outcomes, additional benefits occur as the amount of physical activity increases through higher intensity, greater frequency, and/or longer duration. Most health benefits occur with at least 150 minutes a week of moderate intensity physical activity, such as brisk walking. Additional benefits occur with more physical activity. Both aerobic, endurance, and muscle strengthening, resistance physical activity are beneficial. Health benefits occur for children and adolescents, young and middle-aged adults, older adults, and those in every studied racial and ethnic group. The health benefits of physical activity occur for people with disabilities. The benefits of physical activity far outweigh the possibility of adverse outcomes. Table 1-1, Health benefits associated with regular physical activity. In children and adolescents, there is strong evidence for improved cardiorespiratory and muscular fitness, improved bone health, improved cardiovascular and metabolic health biomarkers, favorable body composition. In children and adolescents, there is moderate evidence for reduced symptoms of depression. In adults and older adults, there is strong evidence for a lower risk of early death, lower risk of coronary heart disease, lower risk of stroke, lower risk of high blood pressure, lower risk of adverse blood lipid profile, lower risk of type 2 diabetes, lower risk of metabolic syndrome, lower risk of colon cancer, lower risk of breast cancer, prevention of weight gain, weight loss, particularly when combined with reduced calorie intake, improved cardiorespiratory and muscular fitness, prevention of falls, reduced symptoms of depression, and better cognitive function for older adults. In adults and older adults, there is a moderate to strong evidence for better functional health and reduced abdominal obesity. In adults and older adults, there is moderate evidence for lower risk of hip fracture, lower risk of lung cancer, lower risk of endometrial cancer, weight management after weight loss, increased bone density, and improved sleep quality. These findings reinforce what fitness professionals have known for years. The human body was meant to move, and it does so with regularity. It responds to the stress of physical movement with improved fitness and health. Guidelines with similar goals and recommendations have been published in the past by the American College of Sports Medicine and American Heart Association, U.S. Department of Agriculture, International Association for the Study of Obesity, Institute of Medicine, and the U.S. Department of Health and Human Services. The 2008 guidelines from the U.S. Department of Health and Human Services marked the first time the U.S. government had enough available research to make the claim that, quote, all Americans should engage in regular physical activity to improve overall health and to reduce the risk of many health problems, end quote. Even with the well-established guidelines for physical activity, the majority of healthcare professionals have little or no formal education or practical experience in designing and leading exercise programs. Physicians often give patients recommendations to exercise, but they generally do not provide specific instructions for how to exercise. ACE certified personal trainers, therefore, play a vital role in allied healthcare by providing services that help clients participate in effective exercise programs that result in positive health and fitness improvements. In the past, personal trainers have primarily worked with fitness enthusiasts in traditional fitness facilities. This role is changing due to the increasing number of adults and children who are overweight or obese and have related health issues. Personal trainers must now be prepared to work with clients ranging in age from youth to older adults, and ranging in health and fitness status from sedentary to athletic. The need for personal trainers to help combat the rising obesity epidemic has led to a positive outlook for personal training as a profession. The Allied Healthcare Continuum. The Allied Healthcare Continuum is composed of health professionals who are credentialed through certifications, registrations, and/or licensure, and provide services to identify, prevent, and treat diseases and disorders. Physicians are at the top of the healthcare pyramid, evaluating patients to diagnose ailments and implement treatment plans that can include medication, surgery, rehabilitation, or other actions. Physicians are assisted in their efforts by nurses, physician's assistants, and a number of other credentialed technicians. When ailments or treatment plans fall outside of their areas of expertise, physicians refer patients to specialists for specific medical evaluations, physical or occupational therapy, psychological counseling, dietary planning, and/or exercise programming. Expand your knowledge. Understanding the educational requirements and scope of practice for each potential team member. Acupuncturist. An LAC, or licensed acupuncturist, has a license granted by individual state entities, typically to have confirmed national level certification, able to perform acupuncture, and may have complementary medical privileges, e.g. traditional Chinese medicine and/or lab ordering privileges depending on the state licensing laws. A chiropractor, or DC, Doctor of Chiropractic, is a post-baccalaureate degree program, typically 4 years in length. A variety of different chiropractic philosophies and practices exist. They do not have prescription writing or surgical privileges. However, depending on the state, may prescribe and dispense nutritional and herbal supplements. Dietitians, RD, or registered dietitians, has a baccalaureate level degree with clinical practicum and national certification testing. In most states, licensure is required to practice as an RD. Naturopathic physicians, NDs, or naturopathic doctors, have a 4-year graduate level naturopathic medical school with all of the same basic sciences as a medical doctor, but also studies holistic and non-toxic approaches to therapy with a strong emphasis on disease prevention and optimizing wellness. In addition, the naturopathic physician is required to complete 4 years of training in clinical nutrition, acupuncture, homeopathic medicine, botanical medicine, psychology, and counseling. Licensure is by a state or jurisdiction as a primary general care practice physician. The scope of practice varies by state law. Nurses, LPNs, typically an associate level degree with clinical practicum. RNs, registered nurse, or BSN, a baccalaureate level degree with clinical practicum and state license and testing. MSN, Master of Science in Nursing. ARNP, Advanced Registered Nurse Practitioner, graduate level degree, typically requiring several years of practical clinical experience, able to prescribe some medications, and practice somewhat independently. PhD, Doctorate in Nursing Studies, typically a title used in an academic setting. Physicians, MDs, Doctor of Medicine, typically 4 years of post-baccalaureate medical school, at least 3 years of postgraduate training upon completion of the degree, able to prescribe medications and therapies, may have admitting privileges at hospitals. DO, Doctor of Osteopathy, same academic and clinical training as MDs, but also have instruction and practicum in osteopathic manipulation. Behavioral medicine practitioners, counselor, baccalaureate or master level degree. Some may have social work or other backgrounds with clinical practicum in psychological counseling. DPsy, Doctor of Psychology, doctorate level degree in psychology. Physical therapists, PTA, physical therapy aide or assistant. Aides are frequently trained on the job, while assistants have an associate level degree. In some states, the latter is required to have licensure in order to practice. PT, physical therapist, a baccalaureate or master levels degree in a physical therapy course of study. DPT, Doctor of Physical Therapy, a doctorate level degree with a dissertation defense in physical therapy. Occupational Therapist, COTA, Certified Occupational Therapy Aide or Assistant. Aides are frequently trained on the job, while assistants have an associate level degree. In some states, the latter is required to have licensure in order to practice. OT, Occupational Therapist, baccalaureate or master's level degree in an occupational therapy course of study. DROT, Doctor of Occupational Therapy, a doctorate level degree with a dissertation defense in occupational therapy. Athletic Trainers, ATC, Athletic Trainer Certified, a baccalaureate level degree with national certification testing, typically state regulated. Responsibilities include injury prevention, emergency care, and therapeutic intervention, working with the team physician and rehabilitation of injured players after athletic injury or post-surgery. Expand your knowledge. The future of personal training. The U.S. Department of Labor, or DOL, Bureau of Labor Statistics 2014, refers to the professionals in the fitness industry as fitness workers, with personal trainers classified as the primary profession within the industry. The DOL defines the nature of the job of personal trainers as work with a single client or a small group. They may train in a gym or in the client's homes. Personal fitness trainers assess the client's level of physical fitness, and help them set and reach their fitness goals. Trainers also demonstrate various exercises and help clients improve their exercise techniques. They may keep records of their clients' exercise sessions to monitor clients' progress toward physical fitness. They may also advise their clients on how to modify their lifestyle outside of the gym to improve their fitness. Expected growth in personal training jobs. According to the Department of Labor, employment of fitness workers is projected to increase by 13% between 2012 and 2022. This expected increase is about as fast as the average for all occupations and is attributed to a number of factors, including the following: increasing number of baby boomers who want to stay healthy, physically fit, and independent, increases in the business, opening on-site fitness facilities and offering incentives for employees to join gyms, growing concerns about childhood obesity, increasing club memberships among young adults concerned about physical fitness, an aging population seeking relief from arthritis and other ailments through individualized exercise, yoga, and Pilates, a need to replace workers who leave fitness occupations each year. Personal trainer qualifications. See recognition from the Department of Labor on page 20 for the Department of Labor's statement regarding the importance of obtaining a quality personal training certification. I will go to that now. Recognition from the Department of Labor. The Department of Labor reports that most personal trainers must obtain certification in the fitness field to gain employment, explaining that there are many fitness organizations that offer certifications and that becoming certified by one of the top certification organizations is increasingly important, especially for personal trainers. The Department of Labor then goes on to state that one way to ensure that a certifying organization is reputable is to see that it is accredited by the National Commission for Certifying Agencies. The American Council on Exercise is one of the few organizations specifically identified by the Department of Labor as offering quality certifications for personal trainers. Other professions listed as fitness workers by the Department of Labor include group exercise instructors, fitness directors, and those teaching specializations such as yoga and Pilates. Physicians and nurses teach patients the importance of implementing their treatment plans. Physical therapists and occupational therapists lead patients through therapeutic exercise and teach them to perform additional exercises at home to facilitate rehabilitation. Athletic trainers teach athletes exercises to prevent injury and take them through therapeutic exercises following injury. Registered dietitians teach clients proper nutrition through recipes, meal plans, food preparation methods, and implementation of specialized diets. While these professions might also give patients or clients guidelines for general exercise, like try to walk up to 30 minutes per day, most days of the week, few of them actually teach clients how to exercise effectively. This is where personal trainers hold a unique position in the allied healthcare continuum. The majority of personal trainers will work with apparently healthy clients, helping them improve fitness and health. Experienced personal trainers with advanced education and training will generally have the skills necessary to work with clients who have special needs for exercise programming following medical treatment for an injury or disease. An advanced fitness professional providing post-rehabilitative exercise programs will need to have a solid position within the local healthcare community. In more clinical settings, the advanced fitness professional may work under the direction of a physician, physical therapist, or other rehabilitation professional, while in a club setting, he or she may be more autonomous. In all situations, it is crucial for the fitness professional to stay within the boundaries of his or her education, certification, and legal scope of practice, and to work closely with each client's referring physician and other healthcare providers to ensure that the exercise program is complementary to their treatments. Refer to Chapter 18 for tips on how to utilize these relationships to expand a personal training business. It is important that every personal trainer understands the role of fitness professionals in relation to the other members of the healthcare team. Each client will generally have a primary care physician who is responsible for his or her general medical care. If the client is referred by his or her physician, the personal trainer should obtain written permission from the client to communicate with the referring physician to provide regular reports regarding the client's progress with the exercise program. Even when the clients do not have a physician's referral, it is important for the personal trainer to maintain confidential records that include the client's progress. Even when the clients do not have a physician's referral, it is important for the personal trainer to maintain confidential records that include the client's program, progress, and health history information.